Every 40 seconds, one person suffers a stroke, and it claims a life every 4 minutes. Stroke is now the #1 cause of long-term disability and the 4th leading cause of death. For more than 12 years, Stryker Neurovascular has been developing acute stroke products focused on complete stroke care. Stroke is a disease that affects the arteries leading to and within the brain. When stroke occurs, time is of the essence. Getting the blood flowing again can make all the difference in survival and recovery.
There are two types of stroke. There is either a bleeding stroke, it's formally referred to as a hemorrhagic stroke, or there is an ischemic stroke. An ischemic stroke is interruption of blood flow to a portion of the brain that, if not treated in a timely fashion, is very likely to produce permanent injury to that part of the brain.
The American Stroke Association estimates that first-time strokes will grow from 16 million each year to 23 million by 2030. This life-threatening disease can be devastating, and every minute matters, but with rapid intervention, many can survive stroke and lead productive lives. Roberta Kaiser can attest to the importance of timing and treatment.
Well, fortunately, my daughter called me at 8:30 in the morning and woke me up. And I went to my computer and I was sitting there checking my email when I got this terrible feeling that I couldn't move my body. And I couldn't, nothing was working right. And I threw up. And fortunately, the phone was right there, and I dialed 911.
Because this was a patient who came to the emergency room and very rapidly deteriorated to the point where she became paralyzed in all her limbs. She lost consciousness, she lost her ability to breathe, and she was well on her way to dying from an occlusion of her basilar artery.
Know the warning signs of stroke: numbness or weakness of the face, arm, or leg, difficulty speaking or understanding, blurred vision or trouble seeing in one or both eyes, sudden or extremely severe headache, dizziness, confusion, or loss of balance and coordination. Any one of these signs may indicate an acute ischemic stroke. If you or someone you know exhibits one or more of these signs, call 911 immediately.
If we hadn't brought her right away to the cath lab and extracted this clot with the Trevo device and do it in such a rapid manner, she would have been left either devastated or dead.
So with Stryker, we have the first fully visible stent retriever on the market called Trevo that has the capacity to go up through the groin all the way up into the brain, grab onto the clot and pull it out and give full revasc quickly.
The technological advances of the Trevo ProView Retriever assist with the many challenges doctors face in treating stroke patients rapidly and successfully. It is the first and only fully visible device that allows doctors to view placement and strut behavior, thereby setting a new standard in precision and retrieval.
The retrieval process is accessing the clot with a standard microcatheter and microwire. Once accessing the clot and passing the clot, the microwire is removed and the stent retriever device is delivered through the microcatheter and deployed into the clot. Once it's deployed into the clot, it expands and integrates into the clot, and thereby facilitating removal by retracting the microcatheter and the stent retriever device out of the vessel.
These devices now allow us to very rapidly and very predictably retrieve clot in the setting of acute ischemic stroke. And this has really enhanced our ability to treat patients with this particular kind of problem.
As approximately 87% of strokes are caused by a blood vessel blockage in the brain, and there have been limitations to the effectiveness of thrombolytic drugs, an alternative treatment has been needed.
The risks of waiting are that the longer the time from onset of symptoms to when the patient eventually sees medical attention, the more likely the patient is going to suffer irreversible damage to the brain and be left with permanent neurologic deficits and permanent functional deficits that will alter that person's life.
$700 to $800 million is spent on disability from stroke. So if we can affect that business quicker, then we can actually improve on the disability that's out there.
You know, I was always afraid of a stroke, and I was afraid that I would not be able to talk, that my body would never function correctly. I have friends who had a stroke and can't talk well to this day. So it was amazing that with the therapy, with the doctor's procedure, that I am normal and can live a normal life.
Know the facts. 80% of strokes are avoidable. Take control of your health, but if you or a loved one shows symptoms of a stroke, there is hope. Quick response to get treatment saves lives like Roberta Kaiser's every year.
You know, strokes are not a respecter of age. We've had patients, 20, 30, 40. It's not just in their 70s, 80s. So when we can impact the life of someone, especially younger, that we know will not have those disabilities for the rest of their life, that's impactful.